Hi, I'm Dr. Andrew Coulson. Today I'd like to talk to you about how vitamin D plays a role in your peripheral neuropathy. You always seem to hear in the news that there's some new vitamin to consider or some deficiency to consider. But when it comes to peripheral neuropathy or any autoimmune condition for that matter, it's very important that patients are taking vitamin D to help their immune system. Modern diets are lacking in vitamin D rich foods. A lot of people want to know what vitamin D rich foods are. Organ meats, lard, many forms of seafood, butter, and egg yolks. Remember what I said about eating eggs for breakfast and how important it is to your blood glucose level? Sunlight is another important factor, and another source of vitamin D. But you should never take vitamin D without having your vitamin D levels tested, specifically 25-hydroxy vitamin D and 125-hydroxy vitamin D. Most MDs will only test the 25 form, but it's very important to have both levels tested. This way you're eliminating all the guesswork that can be associated. You could be low in vitamin D or on the low side of normal. Either finding would constitute a different recommended dosage of supplemental vitamin D. Why is vitamin D so important? Well, vitamin D deficiency is associated with many autoimmune conditions, and frankly, autoimmune rates have been skyrocketing in the past 20 years, which correlates with the decreased levels of vitamin D in the general population. Adequate vitamin D levels help to keep the immune system in balance so it doesn't swing out of control and cause an autoimmune disorder. When it comes to migraines, the problems with vitamin D deficiency are made worse, especially by genetics. And many people suffering from migraines need a higher amount of vitamin D to maintain their health, even if their blood tests show sufficient vitamin D. Do not take vitamin D without having your blood levels tested. You need both 25 and 125 hydroxy tested. 25 is the storage form in your body and 125 is the active form. You need both of these levels checked. In many cases, a patient will come to my office with only one level checked and their vitamin D levels will be on the low side of normal, and they've been told, you know, you're fine, there's nothing wrong with you. When actually, if you're on that low side of normal, you need to be supplementing with vitamin D. I recommend that all my patients with peripheral neuropathy or autoimmune conditions take extra vitamin D. If you'd like to partner with us in addressing your concerns, call our office at 763-494-0828 to schedule your exam, and we hope to see you soon.